It's quite an honor to be the provider of the year. And I think it's really fitting for Charlie, for Dr. Frazier, when you think about what he has done in his career. There are very few people like him in the country. We are so fortunate to have him here at Riverside.
He said to me once, he said, you know, we improve population health and we improve community health, one patient at a time. He certainly loves and cares about his patients, but I think he really cares about all of us and really helps us in our care for patients.
Another gauge of the caliber of the man and why he is so willing to give is the amount of love that Charlie was always free and open to express about his wife and his children.
Charlie set the example for every parent that came in around him. So I remember him that way from those early years when his family was young. And I think everybody should know that that's who he was. He never lost touch with his role and responsibility as a father and as a participant in their care.
In the cancer program, I'm sure he has a great passion for our whole system, but we have truly been taken care of by Dr. Frazier.
Charlie has always solved problems, whether he knew how to do it or not. He would find out things that were important to his patients or fellow caregivers, and if there was not a solution, he would learn how to create a solution.
When you're working with Dr. Frazier and he's thinking about how we care for patients and how we use the EMR to better care for patients, he's not just thinking about what is their ailment, what is their chief complaint on that day. He's really thinking about the whole patient.
The other thing that was so impactful, we were working on how to deploy the vaccines. And I remember talking with him saying, you know, we've got these weekend clinics, but we need to have ongoing deployment. And we have 26 primary care sites. Why can't we do that there? And he was able to say, yes, we can do that. So through his leadership and creativity and curiosity, we were quickly doing 10,000 vaccines a week.
He was a natural leader, and as we moved into looking at Epic and advancing our electronic health record, he was one who had a track record that everyone was willing to follow.
When Charlie transitioned from full-time medical education, he went into IT, and I would say he was one of the first chief medical informatics officers in the nation.
When we were in the process of trying to replace our best-of-breed collection of systems that we had, we used an analogy to a Rubik's Cube, that we had all these different colors out there, all these different systems, and we had to somehow integrate them, and it just got harder and harder to do that. We were trying to solve the Rubik's Cube and end up with one solid, fully integrated system, which is what Riverside now has with iCare.
Charlie was an early advocate for the free clinics, especially the local free clinic to Riverside, to have access to our electronic medical record system. I remember the relief that was had when he told them that they would come alongside us and that they would have access to the electronic medical record as well. The best story that has continued to be told over the years about Charlie and that access to the electronic medical record is through the eyes of a patient who was being seen by a volunteer cardiologist at the free clinic. She had come in on a Thursday. She was told through testing that she needed to probably have some intervention in her near future for her condition. 2 days later, she found herself in the Riverside Regional Medical Center emergency room being seen by one of our cardiologists. That cardiologist was able to pull up her medical records, update in the electronic medical record system. He was able to see an echocardiogram that was done on her behalf, and she was scheduled 1 day later. The next morning, she had a pacemaker installed. So she considers that experience life-saving, and when they tell that story at the free clinic, they tell it as though Charlie Frazier was part of how that life was saved.
I think Charlie's lasting legacy will be in his commitment to not only improving the systems that we work with, but improving the willingness of the people around him to want to do better. And his personal hobbies are just unparalleled.
I understand that he just recently created a pizza oven and he's now making Napolitano-style pizzas, which are the best pizzas you can have.
Dr. Frazier has gifted some amazing raffle prizes, and I'm thrilled this is caught on film, because what I'll speak to is, Charlie, you still owe me a Low Country boil.
He keeps bees, he brews beer, he rebuilt a boat, he also has built a pizza oven, so he really is a jack of all trades. Anything he takes his mind to, he can do. He does a lot of woodworking. One time we were discussing that, and I said, you know, I've always wanted a charcuterie board the size of my whole kitchen table. And for Christmas that year, he gave me a handmade, wooden, hand-planed charcuterie board that is literally the size of my entire kitchen table.
Roasted nuts for people at Christmas time. Every time I turn around, he's got a tiki hut or some kind of hut. He's always working on something.
Charlie Frazier, as a person, is one of the nicest people I've ever known. And he's got a great sense of humor. He's very intelligent. He's very dedicated, very committed to Riverside's mission, and everybody loves him.
At a cellular level, as long as I've known Dr. Frazier, he has manifested philanthropy in every aspect of his life.
If I was asked to give a tagline for Charlie Frazier, it would sound something like this: Dr. Charles Frazier, a fear not innovator and a groupthink advocate. And when I say that, I speak to the influence he had as an early Riverside physician who believed that we had a chance at making philanthropy a success.
He's more than deserving of the recognition for the service that he's provided to this community and this region.
That is Dr. Frazier, right? It's not about the patients that he's helped or the things he's accomplished or the EMR he helped launch or all the great data he brings to the organization, but it's about, after I'm gone and no one's saying my name anymore, Riverside is better for me being here.
When all of the people we love and care about say, where do I go? We want them to be able to say Riverside. And Charlie's the kind of doctor that allows you to say, if you know Charlie Frazier, you're going to want to go to Riverside.